Welcome to our Chiskin Communication Network meeting. We're going to start. If you could click on the three dots on the top right of your image, select your name and enter your first name and pronouns and organization and agency name. If you don't see it, your image is, just check your view settings on the top of the bar and set to see all webcams or side-by-side gallery view. Please make sure you are muted and your camera is turned off if not speaking. Okay, we've spotlighted some sign language interpreters. For those needing sign language interpreters, we have spotlighted them. Their names are Ashley and Carmen. Please send a direct message to them if you have any issues. During this meeting, we're going to speak loudly and clearly, speak at a moderate pace. Please avoid adonyms, jargon, and technical vocabulary. State your name when you are speaking and for our interpreters. Captions and transcripts. To view captions, click on the menu arrow next to the closed caption button. Choose from the showing subtitles or full transcription or both. You may adjust the size of the caption if you wish. You can also hide subtitles if you do not want to see the text. Some Zoom navigation. Here they are. And if you need help with any interpretation or accessibility concerns, please direct message me, Linda Ramirez. And we want to take a moment and thank our interpreters. Thank you for being here. And welcome to our ComNet meeting for today. We are glad to have you here. Some housekeeping items. Please list your name, pronouns, and affiliation in the chat. Some icebreaker for today is, what is your favorite fall comfort food? I would say mine is more a dessert. So I would say an apple crisp or a peach crisp. The peaches are good right now, so it makes it a delicious peach crisp. If you could put that in the chat, that would be great. And if you are new here, please add your email address in the chat so we can make sure you are added on our future communication network list. This meeting will be recorded. And we want to take the time to honor the Native people and experience. The Washington State Department of Health and Children and Youth with Special Health Care Needs program recognizes and honor the original occupants and stewards of the land where we are individually and collectively gathered. Many of us are occupying space from the lands that are the traditional home of the Coast Salish people and the traditional homes of the tribes and the bands within the Wamish, Suquamish, and Tulalip and Muckleshoot nations. The Chiskin program honors the survival and adaptations in the forced assimilations, resilience, and creativity of the Native people, past, present, and future. We encourage Chiskin partners to consider their responsibility to the people and the land, both here and elsewhere, and stand in solidarity with the Native, Indigenous, and First Nation people and their sovereignty, cultural heritage, and lives. We also pause to recognize and acknowledge the land upon which our country, state, and institutions are built. We remember that our country is built on the land of enslaved people who were kidnapped and brought to the U.S. from the African continent and recognize and continue contributions of their survivors. We also acknowledge all immigrant labor, including voluntary and involuntary, traffic and forced and undocumented people who contributed to the building of the country and continue to serve within the labor force. We also acknowledge all unpaid caregiving labor. To the people who contributed to the immeasurable work and their descendants, we also acknowledge our indelible mark in the space which we gather today. It is our collective responsibility and critical interrogate these histories and repair harm and honor, protect, and sustain their land. This land acknowledgement was adapted from the Seattle colleges. Please share the people you honor in the land you are occupying in the chat. And this link will be placed in the chat. And I also want to recognize that I am on the Chehalis tribe lands today. And I also want to take a moment to honor my parents who came to this country as undocumented migrant farm workers, part of many individuals who continue to do essential labor today. Their hard work and sacrifice and resilience lay the foundation for the opportunities I have today. And without them, I would not be able to do the work I do. And here is the agenda for today. We've done the welcome and agenda, and we're going to do the program updates. And then we're going to have Wick. We're going to have Brittany from the DOH come and give us some updates on WIC. And then after that, we're going to have Lilianne from DCYF present on family separation and rapid response, the work that she's doing. And then we're going to take a little break, and then we're going to come back and have HCA present. Rebecca from HCA will present on Medicaid updates. And then we're going to have Jamie from DDCS have some updates from there too. And then we're going to take a break, and then we're going to come back for our open networking hour. And then that will be it. And I want to do a welcome for our DOH Chiskin team. If you just could turn on your camera and wave quickly, that would be great. So Monica Burke is our Chiskin program director. Nikki Dyer, our family engagement specialist. I'm Linda Ramirez, our Chiskin Communication Early Childhood Consultant. And then Kimberly Schonecker, our Chiskin Nutrition Consultant. And then Amanda Simon, who is our Process Improvement Specialist. If you want to contact us, you can contact us at thechiskin@doh.wad.gov. And I'll pass it back to Monica.
Hello, everyone. Hope you all are having a great morning. I just wanted to start us out today with some updates about our final maternal child health block grant strategies for our children and youth with special healthcare needs program. So I know we've talked to you about this quite a bit over the past couple years. Every 5 years, as part of the maternal child block grant, which funds most of our work here in the Children and Youth with Special Healthcare Needs program, we do a needs assessment. And so over the past year or two, we've been doing a needs assessment, and then that helps drive our action plan for the next 5 years. So we just over the summer submitted our application for our block grant for this year, which just started on October 1st. And as part of that application process, we submitted the results of our needs assessment, as well as a new action plan for the next 5 years. So this is kind of a time of restarting, shifting gears as far as our maternal child health block grant program goes. And I'm really excited about the work that went into this. Our surveillance and evaluation team just did an amazing job on conducting a really thorough needs assessment. And I really appreciate, we had a couple sessions with this group. I really appreciate all the input that you gave. And we've also been hearing from lots of other folks around developing our action plan for the next 5 years. So since it's the start of a new 5-year plan, I wanted to make sure to share out what we came up with as our strategies for the next 5 years. And we'll be continuing to kind of flesh out our action plan over this next year. And we'll continue to be coming back to you all and talk about these in a little bit more depth. But I'm just going to go through it pretty quickly today because we have a really full agenda, lots of great information for you this morning. Based on the needs assessment, the priority need that was identified for children and youth with special healthcare needs is really broad in terms of access to comprehensive and coordinated health services and supports. So really making sure that children and youth with special healthcare needs and their families have access to a wide range of services that they need, and that those services are coordinated. And there's 3 main areas that we identified to focus on. Those are care coordination, accessing needed referrals, and family-centered care. And I will kind of go into each of these areas in just a little bit more detail. We also have, as part of this action plan, we have different measures and metrics that we're going to be looking at on an annual basis to help us determine how well we're doing. Several of these are kind of from a pool of different outcome measures that the federal government has for children and youth with special health care needs. So our national outcome measure is a well-functioning system of care. So this is a pretty high bar for a system of care in terms of determining whether a family has a well-functioning system of care. So they have to meet like five core components where the family feels like they're a partner in their child's care, the child has a medical home, the child gets their medical and dental preventive care, they have adequate insurance, and they have no unmet needs or barriers. So it's a pretty high bar. But really, about 16% of children and youth with special health care needs in Washington are receiving all of those components of a well-functioning system of care. So that's a pretty low percentage, but it is a pretty high bar to meet all of those pieces. We are looking a little bit better than the national average, which is about 13% in this area, and we rank about 11th out of 51 nationally. Another national outcome measure that we're going to be looking at is children and youth with special health care needs flourishing. Here, there's like 3 items that we're looking at, kind of looking at curiosity and discovery about learning, whether they finish tasks that they start, and whether they can stay calm and controlled when they're faced with a challenge. So those are kind of the 3 components of flourishing. Right now, only 31.6% of children and youth with special healthcare needs in Washington are flourishing on this particular measure. Um, for children that are not children with special healthcare needs, that average is a lot higher at about 67.1%. So we definitely have a big disparity there for children and youth with special healthcare needs. And in this one, we are not doing as well, very well nationally at all. We're actually 49 out of 51 in this measure. So definitely need a lot of work in this area. Um, and then we also have a national performance measure of medical home. And medical home has 5 different components to it, whether the child has a personal doctor or nurse, whether they have a usual source of sick care, um, care coordination, whether they're able to get needed referrals, and then family-centered care. We're doing pretty good in terms of the personal doctor or nurse or usual source of sick care for children and youth with special health care needs. But we are struggling in terms of care coordination, referrals, and family-centered care. So that's why we've decided to focus on those 3 subcomponents. Sorry, some pop-ups here. Can you go on to the next slide, Linda? Okay, and then one more. Sorry, I didn't have you switch. I'm just going to put our needs assessment results in the chat too for you all. Okay, so our first strategy that we're going to be working on over the next year is around the area of care coordination. So we've identified care coordination as one of those components of the medical home that we really need to work on in Washington State. So our goal is to increase to 50% percent of children and youth with special health care needs receiving needed care coordination. Right now, we're only at 43.7%. And that is actually 50 out of 51. So we're really at the bottom of the states in terms of how well we're doing in this. We also see that for children that are not children with special health care needs in Washington, that average really jumps up to 71.3%. So a lot of work to is needed on this particular area. The couple of strategies that we're going to be working on in this area are continuing our care coordination work group. You might have heard about this as like our blueprint group. We've had a cross agency and cross we got a lot of family participants and folks from different organizations around the state that have been working on, looking at our care coordination system, identifying areas where we can improve over the past 2 years. And so we're going to continue that work and try to implement some of the recommendations that we've come up with over the next 5 years. And then also care coordination standards and training. So we've developed a care coordination toolkit. That was one of the kind of first things we did with our collaboration on care coordination, and want to continue to expand that, improve that, and do more trainings for those that are working with children and youth with special health care needs. Next slide, please. Okay, the next area that we're focused on is accessing referrals. Again, this is another component of subcomponent of medical home. We're right now we are at and again, this is all the latest data is 22-23 data, so it is a little bit, it's a couple of years ago. We're kind of this data source lags a little bit. But according to the latest data, about 62% of children and youth with special health care needs in Washington are having no difficulty getting the referrals they need. But the national average is more like 71%. So we're trying to get more up to that national average. And currently we're 48 out of 51 in this area. And for children that do not have special health care needs in Washington state, that percentage is 86.2. So there's definitely a disparity between children and youth with special health care needs in Washington and those without in this measure as well. So our strategies that we're going to be working on in this area is continuing to work on some of our integrated networks work. This includes work on the school medical autism review teams and local communities, the nutrition network for feeding teams and dietitians across the state, continuing to build those networks up, and our kind of multidisciplinary type 1 diabetes work group. Our genetics program at Department of Health is also working on this issue with leading work on establishing mobile genetics clinics across the state. Okay, and then finally, for our third area for our children and youth with special health care needs strategies is focused on family-centered care. And so here, currently about 78% of children and youth with special health care needs in Washington are receiving family-centered care. National average here is about 81%. Our goal is to increase to about 82% over the next 5 years. Right now, we're about 44 out of 51 in Washington on this measure. And the two strategies that we're going to be working on in this area are around children and youth with special health care needs and their families, and just well-being promotion for that population. Some of the things that came out in our needs assessment are, need for more peer support, anti-bullying, concrete supports for families, especially around caregiving, and then having accessible community spaces and feeling that feeling of belonging in the community. We're working with our Family Advisory Council right now to try and identify strategies and with other partners to try and identify strategies to work on in this area. And then finally, continuing our children and youth with special health care needs family partnership work. So making sure that families are involved in all of our planning processes and work with us to let us know what the needs are for families, but also help us to implement strategies that really work for families in our state. And we are using the Family Engagement and Systems Assessment Tool, or the FESAT, to help guide our work and track our progress in that area. Okay. And so that's our main children and youth with special health care needs strategies. There are a couple of other strategies that I wanted to talk about, and that is our cross-cutting or system strategies. So these are things that across our maternal child health programs we're going to be working on together. And it's really cool because both of these strategies are involve children and youth with special healthcare needs. So I think we're going to have a little bit more coordinated approach where we're looking at, okay, all of the programs that serve children and families at DOH are going to be kind of looking at how we can really make an impact for children and youth with special healthcare needs and their families. So the first one is around public health system collaboration. So that's how we at the state level Department of Health are collaborating with our local health jurisdictions, tribal health, state board of health, in order to really have a robust public health system for children and families. And one of the focus areas is children and youth with special health care needs, and also looking at the prenatal to 5 population, make sure we're also identifying children and youth with special health care needs early on. And so that's a continuation of, if you've heard about our learning journey work, that's a continuation of some of that work, continuation of some of the great work that's been happening in the child health program around early childhood. And then we also have a family involvement program that Nikki's going to be working on with our partners in Oregon to really kind of recruit and train family leaders on the maternal child health block grant process, so that we have kind of a pool of family leaders that really understand the block grant and can help us get kind of real-time feedback as we are implementing our block grant strategies. So, just wanted to go ahead and share this information with you all so you have kind of a grounding of what we're going to be working on in the next 5 years. I know this is a lot of information, but I wanted you to have it, for your records, and we will continue to come back to these issues and talk about them in more depth at future meetings. But just wanted to give you an overview as we're starting our new 5-year block grant cycle of what we're going to be working on. And if anybody has any questions, you can feel free to share them with me. Okay. And then if you can go, yes, thank you, Linda. So just some other quick program updates. Just a reminder to sign up for our new Children and Youth with Special Healthcare Needs ComNet newsletter that we have out now. This is once we have the recordings and notes from this, that they'll be shared here, but also lots of other information about children and youth with special health care needs. We're distributing that newsletter about quarterly right now. Linda created this amazing new social media emergency preparedness toolkit. So if you're interested in getting that, you can reach out to Linda for a copy of that toolkit. We also have our Washington State Leadership Initiative newsletter that is more family organization focused. So you can also sign up for that newsletter. Let's see. And then we have a couple of new documents that we are excited about. We have a new Family Advisory Council report from Nikki. And then we also have a really amazing new strong and growing transition guide. It's kind of designed for young adolescents with chronic health care needs, and is, Kim has been working on this all summer, and it's just an amazing product, such an improvement. We previously had like a teen to tween guide, and it was pretty dated. And so she's really done a great revamp of it, got a lot of great input from our Youth Advisory Council, and really excited about having this new resource out there. So I will put the links for both of those in the chat. Also, our Type 1 Diabetes Teen Connect is on hold until further notice. So you can reach out to Kim if you have questions or need other options, and you can also subscribe to their the Type 1 Diabetes Work Group updates. And I'll put the links for those in the chat. Next slide, please. And then finally, just a little update, and I think Kate will share more information probably at our lunch networking session about some of these options, but I just wanted to share a little bit of update around the WA Include collaborative. We work really closely with Kate and the medical home team on the SMART team portion of this, which is the school medical autism review teams, but wanted to make sure that you all are aware of all the kind of new resources that are available from the Include collaborative. There's a lot of echoes that are starting soon where you can get training. There's a really great one on resources, uh, and then also Autism Centers of Excellence trainings, new work on Cascades, which is kind of collaborating with school district personnel on autism diagnosis and evaluation. So lots of great stuff happening there, and I think we'll pretty much out of time now, so I think we'll have Kate share a little bit more about it in our lunch hour. And thank you, Kate, for putting some resources in the chat there as well. Anything you wanted to say real briefly, Kate?
No, I'll just wait, but the wainclude.org has a lot, and I'll be there from 12 to 1. Thank you.
Okay. Thank you so much. Okay, I'll turn it back over to you.
Okay, we're gonna welcome Brittany from WIC from DOH. She will be presenting on WIC updates. Brittany, are you ready?
I am. Good morning and happy Thursday. Thank you so much for allowing me to come and join and just talk about a program that is very near and dear to my heart, and just given the government shutdown, acknowledging a lot of misinformation that's going on, and also just sharing live updates as we can to help support the families that we serve across the state for providing WIC services. And so I'm just wanting to kind of share what we know now. We did get additional funding just early this morning, and so our timelines previously have kind of shifted as we've been able to access additional food funds. And so at this point, we do have sufficient food funds to support all of our participants, or even anticipated participants, through the month of October. And so please do encourage your families to redeem their benefits. We have messaged this out to the stores. We are updating our WIC Shopper app, which is a app that is used by our families to redeem their benefits. About 90% of our WIC participants across the state use the WIC Shopper app, so it's a really wonderful tool that we utilize to get accurate and timely information into the families that we serve. And wanted to just share broadly that is currently the status. Unfortunately, we didn't receive any additional administrative funds. So right now, the state team is operating under continuity of operations. So we are a reduced team of 10, continuing to maintain our participant database and being available for our WIC clinics across the state. We do have some clinics that are using community resources to keep their WIC staff operational. We are planning on doing after the fact contracts once our grant is awarded, and we'll be reimbursing agencies as we can for WIC clinic services that are provided. So I know the WIC food package is so helpful for a lot of families. We also have registered dietitians, lactation specialists, and other community referrals and resources that really enhance the benefits that we provide. It's not just about food, but it's also looking at what additional resources families need and making those referrals and connecting them with that additional support and help. So it's really important to maintain a lot of those clinic openings, but we are seeing a few clinics having to close their doors because of the shutdown. And we were able to work with one clinic that they will be able to remain open. So at this point, we only have one clinic closure. The Tri-Cities Community Health WIC Clinic closed on October 3rd, and Benton Franklin Health District has been really helpful in supporting those WIC clinics, our WIC participants during that closure. And so there's a lot of things that are moving very quickly, and we are doing our best to make sure that our communication is going out, trying to make sure that we're in these spaces to share what we do know currently and what our plan is to support participants. I think something that is weighing heavily on our minds as a state is what happens when food funds run out. We do have several families and infants that use formula through WIC. That is a big part of our program, and really does support that important nutrition for our infants. When we experienced our formula shortage, we did see things happen, families doing their best to try and keep their babies fed. And so we're working on guidance to make sure that that information is in families' hands. And we're also working on a coordinated effort at the state level to direct folks that want to help support these families with formula donations. We also do partner with Medicaid and are working with figuring out those participants that are on specialty formulas that can be very, very expensive and hard to access, to figure out how we can support that continued benefit for our families, and thinking through that coordinated effort across the state. And so as you all are plugged into your communities, or if there's information that would be helpful, or organizations that we should talk to, we are really trying to do our best to make sure that if the shutdown goes past the end of the month, we are not losing and slipping families through those cracks, and have information for those families to go and get that important formula, as well as food that is needed. And so wanting to just kind of share the overview of what we know now, what our intention is in terms of providing that coordinated effort to make sure that our families don't fall through the cracks during that time, and want to just acknowledge that piece. And I probably should have given a little bit of an overview of WIC. I assume that everyone knows about this amazing program, and that assumption may have been errant. So WIC is the Women, Infant, Children Supplemental Nutrition Program, and we provide nutrition education, a food package that is tailored to participant needs, whether they're pregnant, or lactating, or postpartum. We do have a specific food package tailored for those participants. And then we have our infants, whether they are breast or chest feeding or formula fed. And then we have our child package that starts at the age of 1, and also can have additional supplements depending on their needs. And so those are our food package. And then we do have access to those registered dietitians, our IBCLCs, or International Board Certified Lactation Consultants, and our breastfeeding peer counselors that provide support to our participants, and then our community referrals. We really do our best, and actually it is a requirement for the WIC program to refer to other community resources. So if families are struggling with diapers or with utilities, we do our best to stay plugged into community resources and connecting and doing that warm handoff for our participants to be able to access those community services. So I apologize for getting a little bit ahead of the game and wanting to provide that high level overview of our WIC program. So Leanne, I do see that question in the chat. You can tell your families to please go redeem their food benefits this month. They will not be turned away at the store. Those are available for our families to redeem. And seeing a question around, we did learn yesterday for the goat's milk infant formulas, Walmart does have them in certain stores, or they can order online using SNAP benefits. Thank you. That's really good to know. I know that we do have some of our WIC families that prefer the goat's milk infant formulas, and that's something we try to make sure that they have information on. We do, as a WIC program, have what is called a WIC rebate contract. So we do contract with Abbott, who is a Similac distributor. And through that contract, we receive rebates for every can of formula that is purchased. And that rebate funding is applied to food. And so it allows us to serve more participants, but it does make it a little tricky in choices for our WIC families in being limited to what is currently in our contract formula, or we do have specialty formulas that we work with providers to make sure that our families have access to. So thank you for that call out to just different options for formulas. Yeah, thank you. So that question around when or if goat's milk would be added to WIC specifically, I think it's something that we are working on getting added. Our food package is congressionally voted on. And so while states have some ability to add different amounts, I know that goat's milk is available for WIC participants. So that is something that is eligible. I need to do some follow-up to figure out if we have goat's formula that's available. I think that may be a little bit of an exception, but we do offer goat's milk currently with our WIC food package. I think the participant just needs to request that preference with their local WIC clinic. Are there other questions that would be helpful? Oh, yes, absolutely. I will go ahead and put my email in the chat. Yeah, thank you, Tracy. I'm always honored and humbled to be able to talk about a program that has benefited me directly. I was a previous WIC mom, and so I feel honored to be in a space where I can give back and speak to the importance of this program from a very lived experience. All three of my kiddos were WIC babies, and I'm truly grateful that I was able to have access to this program when I was in need of it as well. Okay, I went ahead and did put my email in the chat. So if you have any questions, or if your families are having a hard time getting into a WIC clinic, or if you have special needs, please do reach out to me. We will coordinate getting that information to you and to the families that you serve, and just really appreciate all that you're doing to support our communities and our families. We know that it truly does take a village, and I have seen such an incredible amount of love and support and asks for how folks can help support this program if we do run out of food. And so we'll continue to get information out, attend these spaces to educate and advocate, and just continue this incredible partnership as we wrap around our families in this state. So thank you for having me, and look forward to future conversations.
Thank you so much, Brittany. Thank you for taking the time to present and talk about WIC. Yes, and we'll move on to our next presenter. We're ahead of time. So Lillian, I don't know if you're ready to present.
Yeah, thank you, Linda.
Would you like me to share the slides, or do you want to share your own slides?
I'll share just because I have, yeah, I'll share. I have some websites I want to show folks.
Okay, perfect. Thank you so much.
Yeah, let me just pull up one more website. Okay. Hi, everybody. My name is Lillian Ferraz, and I use she, her pronouns. I've been working at the Department of Children, Youth, and Families since March, so a few months now, specifically on the Family Separation Rapid Response Team. And this team is really working to improve policies and practices to protect children whose parents or guardians have the potential to be detained or deported, or they have been detained or deported due to their immigration status. And all that being said, you know, this is a really difficult topic, and landscape is changing all the time. Government in general is being challenged daily to support its people in Washington and around the country. And so I just want to say that I really understand if there, you know, any type of question is welcome here at this time. If you want to request that I slow down or kind of go back and mention something, I just want to ask really quick and double check, Linda, how much time, just with, I know that starting a little early, I just want to check what time you think I should use for the presentation.
We had you till I believe, let me check.
10:50.
10:50. Thank you so much.
50?
Yeah.
Okay, checking. Thank you. Great. So I'm glad that we have the time, just because it is a really complex topic, and we've reviewed so many different policies. I'm going to focus on our resources that are available for the public first, and then I'll go through a little bit of what the next steps of the team would look like. It's a very fast-moving team. So we already have an executive order for the next kind of iteration of this group that I'll tell you about. But we've looked at over 35 separate areas of policy across the state, and so I can't cover them all in the time. And if you're passionate about something or you have a question, more than likely I've seen the question before, but I also really encourage questions, because a number of those policy areas were because subject matter experts like yourself from across the state, working for nonprofits or for-profit businesses or for government, those questions have really helped us identify the challenges for Washington immigrant families in this situation. So I just really want to encourage you to unmute or put it in the chat, any kind of questions that you have at any point. Let me just pull up my slides, and I'll give you all a understanding of the work. So we in September, October. I meant to write October. I wrote that yesterday. Sorry. I don't know what day it is. But the Family Separation Rapid Response Team was started with Executive Order 2504, which was signed on January 27th by Governor Ferguson. The main intent of the policy review body is to review policies related to the support of children whose parents or caregivers are detained or deported, and to provide policy recommendations for the Gov's office. It is being run through the Department of Children, Youth, and Families. We have reports about every 3 months. I did ask to skip the October report so I could focus on the final report. So there's about 3 of them, and they're on our website. Our structure is really a large body, which meets, used to be every 3 weeks, and in the last few months has been monthly, with a lot of ad hoc work in between. We have state subject matter experts. I think at least 35 people in the room in a given moment. I would say over 25 agencies at different times based on the policy that we're reviewing. We also have, I think, our strongest partners in many ways, other than the Department of Health and those in our steering team, is from state commissions, specifically Maria Seguenza from the Commission on Hispanic Affairs, or CHA, and Nam from, I believe it's Nam Wen from, I'm blanking on his last name, I'm sorry, from the Asian American Pacific Islander Commission. I'm getting that acronym wrong, but regardless of my poor memory of acronyms, our team members have been really, really useful in determining where families interact with policies at the state level. Everything from Keep Washington Working to how we manage our data across the state, to how we fund students with limited immigration status through higher ed. So, I mean, really across the gamut. And so I also just want to emphasize, I've worked with state commissions on multiple cross-state projects in my time as a state employee, and I just really want to encourage more programmatic connection with these state commissions. They are so well connected to our communities, and their partnership is truly invaluable. So just highly encourage that as you consider how to enact change here in Washington State. Our legislative representatives have been in and out, depending on session time mostly, with Senator Wilson really leading the charge there. Community partner organizations have also been sort of in and out based on the subject matter area of their work, but KIND, NERP, LCYC, and WISN, those have been our core partners. They've been involved since the beginning because of the number, specifically with KIND, NERP, and LCYC, specifically with the rapid changes to the legal framework of immigration that we've been dealing with. They have been just the best resource that we could have. And so I'm very grateful for their partnership. The couple of pieces I want to highlight on how we do our work, how does it happen? So as we review policies throughout the months, another thread of our work is funding. I think a budget shows your values, and the departmental proposal process. Sorry, there's literally a woodpecker pecking on my wall right now. It's very distracting. He likes that spot. So the departmental proposals process, as you all likely know, but in case you don't, is the way that our state agencies request funding and changes to our Washington Administrative Code through the legislative process. And state employees know that this is a very closed door process, often even within agencies. And so part of what I wanted to do, being from Tacoma as an organizer, was to bring in more of a roundtable method to the funding process here, wherein we bring multiple parties to a round table and discuss openly how we all contribute to a single population and to their success. It still was a challenge to get people to speak up on how their funding plans might go during the session. And to be approved, through the governor. But we made some significant strides. And so in December 20th, when the governor's budget is produced, we will also publish whatever the governor has approved, a joint fact sheet on what we believe should be funded here in Washington State to support this very, very vulnerable population and at-risk population. So if you're curious about how the money's working, that joint fact sheet should come out in December, and we will likely be sending it in our listserv, which you can sign up on our website for. We also have presented, I'm sorry, this woodpecker is really driving my cat wild. You never know. The recommendations that we've put out started in July, and will also be added in January to our final report. Now, between now and January, there will also be a massive transition, and I don't know exactly what that will look like. The executive order 2509 dropped a week and a half ago. And we are doing our best and coordinating with the Office of Equity to transition the work of responding to this rapid federal change in the immigration landscape to their team. And so we are doing our best to do that right now. I don't have any details. We're still working on our first meetings. But as soon as we do, I'll be sending out information on how to contact their team, how that works. I will add some pieces in the chat that they have made already. I think they've created their email. But between Equity and OFM, they will be taking on this work, and I'll discuss that in a little bit as well. So that's a bit of our timeline from January to January, with an offboarding sometime this winter to the next team. I want to highlight our Family Ready resources. This is, of the many requests of the many parts of the mandate in the executive order, we really felt that we needed to add an area of work around resources for families now. So the way that we've decided to do that is because we don't have any funding associated with this executive order, we can't provide resources, nor can we really coordinate on any significant communications work. So what we've been doing is creating a series of flyers, which are legally viable and reviewed by the AGO and ourselves and others, and distributing them to our partners, our state partners, to OSPI. So these have been sent to every school across the state, and through our amazing community based organizations who have been willing to share them in their facilities. And so I'm going to show you what those are. And, folks ask, how can they contribute as an organization, as an individual, to the work of supporting these families in Washington State. And this is my answer, is to share these flyers. So I'm going to go over, for you, I think a great resource is the website. And, you know, we love a Gov website. If you check out DCYF, .wa.gov, you can see it right here in the bottom, sorry, in the top here, the Family Separation Rapid Response Team, which is also available in Spanish and Somali. And starting from the bottom, I just want to emphasize our FAQ. The FAQ here is so important and has been important according to a lot of the CBOs I've been working with, because the truth and information are so important at this time. So whether you directly serve, directly serve families who are at risk of detention or deportation in your program, or maybe indirectly, you might not know their immigration status, etc., or what communities they're from, I highly recommend reviewing this FAQ. It has shown, these questions have shown up in a number of places, and in an ideal world, anyone who is in this real at-need population can come to schools or to state agencies or to county or city governments and ask these questions and get a clear answer. So that is the goal in these, is to just provide information as clearly as possible, working with immigration attorneys, state processes, and others. And this is just a quick note from a lot of our community partners. They are requesting, because of the quick change in policy happening at this time, they're requesting that we and other state agencies create this very simple piece of information, but when information is updated, should be on every document and every website. It's surprising how often it's not, and how often that information is obsolete. So I just highly encourage every government employee to check your information that you're providing about your services and when it was updated, particularly because of the funding cuts that we've been receiving at the federal level. This is more important now than ever. So just a side note on practice there. We have information on our website that is all in these flyers, just in more detail for you. A few more resources than, in each area. I want to encourage you all to watch the child welfare and immigration presentation here given by Doreen Perez, who's in our child welfare office. This just gives an understanding of the number one question that we get from families, which is, what happens to my child if I'm detained? And we can't provide every answer, as the practices and policies of Homeland Security and other agencies now involved with immigration enforcement change and are not followed. But we can explain what we do as Washington State as clearly as possible. There's still a lingering misinformation that we put children directly into foster care or into cages with concrete floors, and we just don't do that here in Washington State. And we want to talk about and be clear about that. And that 5-minute video kind of goes into, how do they interact with state? How would they come into foster care as another one of the families and children we care for? What resources and and rights we have. So I encourage you as employees to look at that. A quick version that you can print in multiple languages available in your facilities is this flow chart, which simplifies as much as possible a very complex system, where we discuss what happens if you are detained as a parent or guardian, and what happens to your child. And the challenge, I think, at this moment is that there's so many children who have an unofficial guardian, and there are a number of issues that occur with unofficial guardianship that we want to try to get families to consider as they make these emergency difficult plans for the possibility of detention. And so just sitting down with this flow chart to go over how would they go into foster care? What are the, signs of child abuse, neglect, or imminent risk that have to happen to get there? How can you prevent going into this entire process? And the answer is the Immigrant Safety Plan from LCYC. Just as much as the red cards for Know Your Rights are distributed thanks to organizations like Weissens and their network, the Immigrant Safety Plan is really that next resource that many immigrant rights organizations and advocacy groups are distributing at this time, and we want to be a part of that and support that effort. Within the Immigrant Safety Plan, it's a large document, also worth printing and putting in your facilities for people to browse, but it's information on guardianship and care specific to Washington State, how to deal with emergency contacts, your rights as a parent, and more. So this document is quite useful and has been useful so far. If you're doing any outreach in communities with families, we highly recommend bringing this. And if you need it translated into something else, you can email this communications@DCYF. Email below. We are translating new ones all the time. I think we're in the middle of 2 more. The main resource that has been the most downloaded here from our website has been this 2-pager, and it covers all the resources that we as a body have determined to be the most useful for families in advance of a detention. And I'll talk to you a little bit about our post-separation flyer and get your input on that today. So the Immigrant Safety Plan is their top, but I also really want to pause and talk about resources for finance and business transitions. This Appleseed Network Planning Manual really is that gritty moment in the first few months that are so fragile for children and families who have oftentimes their main provider detained. When you unexpectedly are taken away from your family, there's so many parts of a life that need to be cared for. And this really talks about those. It talks about credit cards, bills, bank accounts, leases, what to do with unpaid wages, taxes. And another reason why this financial information is so important to discuss in transition is that we're finding from a lot of our kinship care providers that unofficially or officially, we are seeing a marked increase, in some places over 40% increase of children being transitioned to not their grandparents, which is like historically what would happen, but to older siblings. Now, transitioning to older siblings who have families of their own and they're older is possibly the best situation. But many of these siblings are single income earners. They might be in school and they might be very young, 18, 19, 20, unofficially, sometimes younger. And I don't know if you remember being 19 years old, but it was very difficult to figure out how credit cards work and how you pay rent, let alone a mortgage. So, this is a very fragile young population, and it's very important to look at these resources in advance of a detention for families and to talk about what those could look like, and to make plans. So those are our top 2 resources. The others are fantastic. I highly recommend familiarizing yourself with them if you put this flyer in your facilities, and some more information around here, including Keep Washington Working, how you travel with a real ID, and more. So this has been our, I think, most important deliverable as a team in this work. And as I said, it should be available to every school in Washington State. OSPI has provided that as guidance. for the work. For the rest of the presentation, I'm going to talk about our post-separation resource flyer that I want to kind of get some feedback with you on. I'll show you a draft. I just need to pull it up really quick. And also the next executive order, and I'm just going to pause for a moment to see if there's anything in the chat. Oh, there's a few things in the chat. Okay. Yes, FSSRT is the Family Separation Rapid Response Team, and CHA is the Commission on Hispanic Affairs. I need to be better about writing those out in my slide. Thank you for catching that. I will do that later. Some internet challenges. Yes. Okay. Great. Thank you. I'm just checking I'm not missing anything in the chat. So moving forward a little bit, the resources that we've created are really useful kind of in advance of separation, and that is the most useful time to get this information. However, we know that the best laid plans and separations are going to continue to occur at higher rates than ever. So I'm in the middle of creating a post-separation resource flyer, which talks about what do we do, what are the best ways to support families who and children who are in a new home. So after they're put with kin, ideally, or family, or someone who knows them. And DCYF really specializes, as you can imagine, in this area. So we've got a lot of input here from our child welfare team, as well as other experts around trauma and disability. I think one of whom was on this call earlier. I think I heard her voice, but the questions that I have for you are here on the screen. I'm going to take a moment to pull up that flyer. I'm sorry, I should have had it ready in draft. And I just want to see if you have any thoughts on what resources you think are most useful bringing a child to a new environment. Things that are publicly accessible or we can make publicly accessible. Any policies that make this maybe difficult in that transition? And what culturally sensitive modifications would you suggest for the populations that you serve? There's so many different populations across the state that are affected by this issue, everything from linguistic to cultural to intercountry differences. And any kind of resource specific to the communities you serve is very useful. So I'm going to pull that draft up and see if anyone has thoughts on how to support families who are whose children have been subjected to this separation. And this might give you a good idea of where we're going with this. Sorry, this is a very kind of basic draft, but this is where we are. The so trauma and supportive parents. There's some resources we're going to put throughout here. You know what? I think this is not the right copy. I'm so sorry. I really should have had this ready. There we go, version 2. As you can see, we're going through review right now.
Excuse me, Lillian, are you
Yeah.
sharing? I'm just saying the website. Are you sharing a draft?
Oh, I am. Thank you for saying that.
Yeah, it may just need to refresh.
Perfect. Let me bring that up. Okay. And I was sharing my slides earlier, so I'll bring those questions back up. But so the post-separation flyer are for families who have been impacted by separation and where the kin goes into the child goes into the new family. We start with legal advice and referral for kinship care. There's a referral hotline offered through LARC, and I need to get that acronym, but it's offered through King County and their legal resources, which have just been increased in their funding, which is amazing, but are available to people across the state. So they have a hotline to call and talk about guardianship, the immigrant safety plan that I've mentioned. We talk a little bit about consistency and environment and how we support that. There's an informational activity worksheet that I found for that social workers could be using. And if they were in the care of DCYF, social workers would be asking these questions. But it's something that they can fill out with a new family member, with a teacher, with a therapist on their habits, what they like, their favorite things, family members, what makes them feel safe, their emotional well-being. Um, these are all things that we need to think about in the care of a child in this traumatic time. And so there's that resource. We talk about well-being and connection to family. There's some trauma resources here out of NCTSN, which is a national child welfare best practices body that is really useful. And specifically one even for separation for refugee and immigrant children. And then in terms of family support resources, I think these are really kind of amazing anyway for any organization. Two things. One, Help Me Grow Washington. It has been really wonderful to see one resource for families for any state funding, and probably federal too, all in one place. 24 hours a day they can call. You can go on the website in multiple languages, and every resource for children that I have found has led me back to Help Me Grow Washington. So there's an effort to put it all in one place, and I think it's been really amazing. So this is a good resource for families. 211 and Washington Connection as well. This is offered through the Office of Financial Management. And if you don't use this with your clients, I highly recommend doing so. With the people you serve, I've used it. The Washington Connection is this really interesting website that you answer like 20 questions and then it pops out every public benefit that you can receive. So it's a one-stop shop to understand what benefits you're eligible for. And so if you have public benefits, they're likely on here. And if they're not listed, I would contact their team. It's an amazing effort. And I think not advertised quite enough quite yet. So I I'm a big fan of this work. Others that we have found as a policy team that have been most useful for these families are family resource centers. They are listed on these teams, but these are resource centers across Washington state that would typically serve families through schools, kids who are eligible for or fall under the McKinney-Vento laws and things like that. And they really are deeply connected in communities. And I would say kind of like uh, a social worker, a public social worker that's outside of the DCYF system. They really just holistically take care of parental care, children support, psychological wraparound services. It's pretty phenomenal. Yes, Jill mentioned hopefully the process allows them to share about the family that's being deported so they can maintain the connections and remembrances. Yeah, in this document, it talks about how kin and culture are one of the biggest parts of maintaining a healthy environment for the child. And whether it's kin that remains or how to stay in contact with family that has been detained or deported, it's just a critical part of maintaining cultural ties and family ties, and is one of the biggest markers that one of the most important things that experts have talked about. Thank you, Jill. We talk about educational rights and resources. Just as a side note, this has been an important part of our policy review in support of OSPI, the Office of Superintendent of Public Instruction, one acronym I remember, and their team, who has just been stepping up to the plate in the most phenomenal way. Around November, after the election, we saw many students just stop attending school, which is absolutely heartbreaking for families and for those kids. But we have seen many of them return to school. Just as an update, if you don't have kids in school, so they are coming back to the classroom. They are just continuing to be really hesitant to involve themselves or their children with after-school activities, with many other parts of a school life, including even coming into school for a parent-teacher conference. So we still have a lot of support that we need to offer to these families and their right to access. I'll make another side note that one policy we've reviewed has been Keep Washington Working, and there's a communication going out from OSPI on this, in that Keep Washington Working protects students in schools, and a lot of folks are thinking, you know, when their kids go into the classroom, into schools, teachers and staff are trained to respond appropriately should immigration enforcement attempt to enter the building or meet in their classroom. But there's been a real concern about bus stops, about visiting school trips, going on sports visits, and our analysis, excuse me, our analysis of the law has led us to believe that all of those activities, as long as they're associated with the public school, apply. So if your child is on a school sanctioned event, it could be overnight in some campground, it could be any of those other activities, they are covered by Keep Washington Working. How we operationalize that and how we communicate that, I think, is something that will be, it is being communicated, but how do we actionalize that is being transitioned to the next team that I'll talk about in a moment. And I will just say that LA's school district policy has included things like direct home pickup for students, so they don't have to walk to school if they're afraid to walk to school or even to their bus stop. The bus stops are now going directly to people's homes. There's a lot of creativity that we can do to serve families, and the policies and legal frameworks are what we've focused on. And I think the next phase is how do we operationalize a lot of this understanding of the legal framework across our state in the next round. So that's just an example of one of our policies we've reviewed. I think unless folks have comments on this resource flyer or other resources that they've think about, yeah, it is terrifying. Oh, Brittany, please.
Hey, Brittany Lillian, the statewide foster care health program manager at DCYF, and I was just wondering if it might be appropriate to put information about the community care hubs in there, and I don't know if I missed it, but I'll drop the link in the chat. And
Okay.
I know the Healthcare Authority is on here and they may be able to speak more to it, but I think it could potentially be a good resource because it does have access to referrals, and it does connect back to 211 as necessary. So it's a no wrong
Okay.
door method, and it just might be a way to close a loop.
Yeah. What is a community care hub?
I'm learning about these kind of as we go,
Right.
but my understanding is, and Yana, I think I saw you from the Healthcare Authority, so I may need your help here, but it's a accountable community of health, and they are directed at social care supports, but they also work as a community care hub, and so they can refer to other
Mm,
services,
great.
and they do get Medicaid reimbursement from my understanding, but that resource flyer that I just shared with you, it
Yeah.
does talk about like statewide resources, and I believe there's one that kind of covers the 9 areas of the state.
Great. I will look into this. Thank you so much. Because I think it's similar to the family resource centers. And I think that this like hub model, hub spoke, is just so useful. So thank you, Brittany. As long as we can make it easy for people to access resource, that's the goal, right? I can come back to this. I'm just going to share a little bit about how you can, what is the next phase and how you can engage with that before make sure you know about that information. So, and yeah, feel free to interrupt on that point. So as I mentioned, Executive Order 2509 is to replace this work. So the rapid response team as it is now will close. And I know that the Office of Equity and the Office of Financial Management and the Gov's office who are coordinating on this work are building their structure every day right now. They're building their team, and I do want to note that they're doing that without funding. So they have no staff allocated to this work. There was no funding for this executive order either. It was just money that DCYF pulled together from my role. So I just really, my heart goes out to their teams as they try to coordinate this work. I mean, it is something that the rapid response team is trying to support in any way that we can. So that being said, these are the pieces of the executive order that I think are the meat. The first piece is that really around access and specifically language access and access to service. Their the Office of Equity is really skilled. Their language coordinator was a key part of our policy review, and there's a lot of progress to make in that area. So I'm excited to see that this is a key part of their work. Data and data security and personally identifying information is a key part of their executive order as well. It was a recommendation that we built. And just as an idea of what does that look like right now, at the moment, I know of at least 3 separate kind of policy review groups around data. There's one in the Attorney General's office. There is one in WATEC in our state agency around technology. And I believe there's a small group in the governor's office, and they're all working separately. And so our recommendation was to have them work together and really focus on this issue. So they will be a part of key in Executive Order 2509, and the Office of Equity has an incredibly robust data team to bring that out. And excited for that because it's so critical to our support of their work. The last
Lillian,
couple, Yeah,
Just to be clear, did you say WATEC or WATAP?
WATEC.
Oh, thank you.
Yeah, Washington, that's like their technology agency. Um, I'm gonna put that in the chat. Yeah, thank you, Todd. It's just that at the moment they're working separately. We really need to look at state standards, and I know there of at least 4 different, and there's got to be more proposals from state agencies over the last legislative cycle and this one on asking the legislature for funding and support on how to better protect their data. So this is just a big conversation. I'm sure you've seen it in the news as well. Um, the uh, Keep Washington Working Act and our anti-discrimination laws are critical in this work, and they will be evaluating them even further. One way that DCYF has taken the lead on this is through this process, we're coordinating with the Office of Civil Rights. I think that's not their full title, but the Office of Civil Rights in the Attorney General's office to review all of our policies related to immigration on compliance with Keep Washington Working. And I'm hoping to create that into a framework or a matrix or a process that can be used across the state. So likely the AGO will still be doing that, but agency by agency, ensuring that all of our policies um, are working with that. So just an idea of something that might be coming to your agency, I hope. It'll be a recommendation. Ah, okay. So I was just looking at WATEP, that makes sense. So the last two is that they are going to be building this like a state body. Right now we have our state body, the Family Separation Rapid Response Team. I don't know who will be in that new group. They are really well connected to community organizations. So I know that their structures are built in collaboration with community leadership. And so that might look really different. I'm excited to see what it will become. And it's nice to see that in this executive order, there are directly how do we provide support and resources in the order itself. And one thing that I've been exploring and then proposing is a structure of philanthropic partnership. As you all know, it is very difficult at this time to provide state resources. There's just like a huge risk of legal challenge from the federal level on providing resources to immigrant families. And so we were hoping, we're making a recommendation around philanthropic partnership with, maybe Foundations Northwest or a couple of other groups on providing those, providing the dollars that are needed for families at this time. And so this is a way that we might recommend that they move forward on that, and they're really trying to think creatively. So that funding aspect and being flexible is so critical as the framework of immigration just changes all the time. And the big beautiful bill has so much written into it that takes place after the midterms that don't happen now that we can prepare for. It's almost like 2 parts of the same bill. And so I know that that will be a part of the conversation, is not just funding structures now, but how they will change in, what is that, 2 years? Anyway, in the next period of time. Bonnie.
Yes, I have a question.
Yeah.
With our children with special healthcare needs, if a baby is in the NICU or a
Mhm.
child or infant is in the hospital, like a special,
Mhm.
like Seattle Children's or Mary Bridge or something, and the parents then get detained, what happens to that infant or that child is under medical care in the hospital?
Yeah, that is a really, you have really named a very frustrating policy area. So, we are coordinating with this. This is a long-standing issue with care in DCYF because there's an increase over the last 10 or 15 years on the restrictions on how children enter the DCYF system. It's that they have to be in imminent risk of harm and a couple of other pieces. And that is really tricky because at the moment, if a child is in a safe place, whether that be a hospital bed or a bed on a friend's couch, etc., they are not in imminent risk of harm. And that is a piece of policy that DCYF is working very urgently to craft changes to with the legislature because they are not like they're immediately safe, but it's not workable long term. Like what happens after 4 days? What happens to that child? And so the social workers are often called in and made aware, but they have to close the case. Many of these social workers watch for that case. But that actually does happen, not necessarily in a context of detentions, but it happens with children. And so it's a really frustrating part of the legal framework that DCYF has to follow that we're trying to advocate to change.
Yeah, because I'm just wondering who makes those decisions if they're in NICU and they say, okay, I need to do this procedure. Then do they have to go legally and go to do some court things so someone then is appointed to make that decision for that infant or what? If the parents are detained.
Yeah. Medical care for these children is why we push for families to get their guardianship paperwork in order because it's everything from dental care to in the hospital, like all of it. You know, you can't make those decisions unless they're gone through the whole process of going through state care. So it's very frustrating and it's really difficult. It's a difficult part of our system. And I'm sure a lot of the child welfare experts on the call could probably speak to it better than I can. Jill?
I'm just thinking when you talk about guardianship, I know how much and how expensive guardianship is, like with guardianship in transition for DDID individuals. When you're in this situation, are you looking at, can these families afford what happens for guardianship? Is that applicable in this space? Do they have to think about, can I even afford to put all these guardianship pieces in place for my kiddos?
So I'm not sure what was it DDID?
Intellectual and developmental disabilities. There are a lot of legal fees that go for guardianship.
I see.
Oh.
So, sorry, go ahead.
Yeah, I was just wondering if
Yeah.
that applies in this situation.
Not that I'm aware of, and I think when we've talked about this, in a sense of parental rights, immigration advocacy groups, and this is the immigrant safety plan. I'm trying to find the right part. Yeah, intention of parents for care of minor child and durable power of attorney. So, the biggest barrier right now for this is that often these power of attorney forms need a what's the word? A notary, excuse me. So that's the cost that's been associated. Right. The Northwest Justice Project is great. And I think that hotline that we've offered should be able to walk families through that. I don't know. I'm going to look into that cost and see if there's other costs associated. I haven't heard of any in this situation from people who have done a lot of these guardianship transitions. Jill, would you mind just putting that acronym in the chat for me so I can look into those legal fees in that area and see if they apply. That would be really helpful, if you wouldn't mind.
Yeah, just to add some clarification there, I think there's two, different pathways, like there's power of attorney, which is what you're talking about. And then there's like a higher level, which is guardianship, which is usually for adults, but for individuals with intellectual and developmental disabilities, that's something that a lot of our, families of adults when they turn 18, work on getting guardianship of a
Mm,
now adult child, and that is a more intensive process than just the power of attorney, and does
okay.
have generally more legal fees associated with it. So it still might, for uh, individuals that are in that situation, that would be an additional cost.
Yeah. Okay. That's really helpful, Monica. Let's see. I think we have a little bit, about 10 minutes left. And I can, as I'm handling the transition, I'm just checking in with multiple community groups, and let me just make sure I'm sharing my screen properly. Multiple community groups and organizations such as yourself on any input you'd like to add to how this next team is created as they're being put together. So let's see. Anything in the scope of work that you think should be added to the next executive order? What challenges you are having or anticipate having for residents you serve during this federal administration that you'd like to see addressed? Could be in policy, it could be just a frustrating area of service provision that we can add to their policy review. Any kind of questions you think we should be asking as we build the next rapid response team? The equity and OFM team I know is very thoughtful in the way they structure governance, and just appreciate any thoughtful inquiries that we can add into that process. And what leaders you would like to see at the table. So I'm just going to pause and see if that generates any thoughts for y'all.
Maybe can I offer just a couple of thoughts?
Yes, please.
I feel like I'm naive in this area, so please excuse me if this is, I don't know if other folks have different thoughts on it, but one thing it seems like is that there's just challenges with information moving into community. And with sort of the things you stated earlier about there's policies in place that protect people in certain settings, but how do we disseminate that information, and what it looks like on the ground becomes a real challenge. And so I think if there's a way to invite like liaisons, these could be folks that are like family resource coordinators, migrant family liaisons within your schools, your community health workers, just to think about what capacities do we need to build up within a community to have it be as responsive as we would need. Because me within public health, I need other people to communicate my message, right? And so just thinking about how do we build up that workforce, I think would be really, really valuable in the future.
Great. Thank you. And I'm just taking notes, so flipping back and forth between my notes app and here.
I think also kind of like what are those nuanced pieces like the community health workers, social workers at the, like Bonnie talked about, where you have those kind of high complex needs. If you have kiddos who are impacted by developmental disabilities, complex medical needs, if you have kids that are in the special education system, if you have kids that are in behavioral health, just having touch points within those systems, that at least you have a pathway that talks about what are those access points and what are those hiccups that could happen
Mhm.
with those. And also, if you have families that are citizens, what are those things that they are seeing on the ground as citizens in accessing those supports and services, and having their voice at the table
Mhm.
in supporting those kiddos and those families. And then
Yeah.
having lived experience, being a part of developing all of this
Mhm.
gives you the best chance of giving the best response. Always, always, always. So just a way to do that.
Thank you, Jill. Tracy.
Hey, yeah, I was just going to suggest it might be really helpful to consider getting information out through family networks in Washington State who put out a lot of information, often in multiple languages, to families. And I'm speaking specifically of the population we serve, families raising children with intellectual and developmental disabilities and special health care needs. But that would be a great way to get information out to families.
Is Family Networks like a specific organization?
No, it's
Okay.
composed, there's many family networks in our state supporting individuals with disabilities and their families. So examples
Okay.
include Parent to Parent,
Oh, okay.
Informing Families, Fathers Network, and Parent Coalitions. And again, those are specific to families raising kids with disabilities and special health care needs.
Okay. Could I find it's coming up in my search, but the only the main resource that I tend to go to is the Developmental Disabilities Council. Is that somewhere I could like see a list of the family networks that are available?
I, Lillian, I can send you some information.
That would be great. Thank you.
You're welcome.
Okay, I'll put my email in the chat.
Thank you very much.
Thank you. Okay. Okay. Yeah, we have about 5 minutes. 4.
Hi, this is Janet Wyatt from Kitsap, and this may have been already mentioned, but
Yeah.
if we have a family, we had an instance where a family went to court to update her status, and from there she was taken, and the dad could not find her and the child. Is there a way that they can, or a place that they can go to look for them?
Yeah. mm, No. It's really heartbreaking. I think that story and many stories like it are now UW published an announcement last month that there's confirmed 16 incidences of disappearances from ICE. And I'm glad that they have that study so we can openly discuss it. I can find the article probably, but I think it was through KOW. But we have, most of what I do is send folks to the ICE website where it talks about how to find people in detention. I know that our team members, all of our staff here, talk in depth in each case on kids in care about how to contact their family members and stay in contact with them through the entire process to retain their parental rights. But that is where we are in Washington State, and across the nation, is that it is now confirmed that disappearances are occurring. And I know it's way more than 16. I just know that. And so I don't have an answer for that because I don't think anybody does. And it's really, yeah, it is horrific. I think someone put that in the chat.
Yeah, thank you. I was just hoping there
Yeah.
was a source.
Yeah.
I work with Martita May here in Kitsap County. She founded our Kitsap Immigration Action Council, Kayak, and she's a great force and support with families.
Janet, could I ask the favor of having you email me that connection? Just anytime
Sure.
I get a community leader, I want to pass it on to our next team to engage
I
with.
Sure, I will
Great.
put my email in the,
Okay, perfect.
and then you can do that. Thank you.
Thanks, Janet. Amanda.
I know I'm the timekeeper and I'm supposed to be keeping us on track. But one of the things I was thinking about is that I was reading about how kids can now voluntarily uh, deport themselves to ICE. And I was thinking about that as a possible implication for our populations with DD and ID. And had the possibility of not completely understanding that because then they waive the right to an attorney and they waive all of these different rights, but they get promised money at the end.
Yeah.
And-
Yeah, go ahead.
And if there was any way for us to try to, I know it's going to always be a challenge for this team, but to any tips to try to keep families safe, like even from this perspective as we go forward. I know that kind of seems like a low priority as we have all of these huge things, but I know that my little one who is on the spectrum loves to talk to anybody and anybody.
Yeah.
And if they were to approach somebody who was an ICE agent or something like that, and I'm trying to think of older kids who might do that as well. And that's a terrifying thought.
Right. And
Oh,
go ahead.
Go ahead, Lillian. I'm sorry to interrupt you.
No. I'm just thinking about, and I'm just bringing up the news in the chat. I'm thinking about how multiple populations are being taken advantage of. I mean, I think every couple of months they come out with a new initiative that says, oh, you have to sign this paper as an official undocumented person by April, or you'll be fined or deported automatically. If you just sign up, then and these kinds of tactics of misinformation and manipulation of populations at risk, and then you add disability on top of that. I think that is a ripe area. Yeah, go ahead.
Yeah, you already have a vulnerability there, and then then it's just like somebody who is could be easily taken advantage of. And there's all these multiple situations where people who want to do that are inserting themselves where parents can't always, I can't be everywhere 100% of the time.
Absolutely.
So just any information for families as we go forward for the next task force, as they come together for families to try to protect children as these things develop, because I don't want this for anybody.
Yeah, of course. Thank you, Amanda. I think, excuse me. I think what I'll do with this information, particularly around disability rights. It has been something that we've addressed in our resources and discussed, you know, how to weave it in and from a trauma perspective. But I think engaging with the Developmental Disabilities Council, these family networks, and I will reach out to y'all on that, how we can communicate the potential challenges associated and with these issues. Amanda Simon, I'm just going to take a note of your name.
Yes, I met you through SICC.
Follow up. Thank you. Yeah, I'm just meeting a lot of people, so I apologize. Thank you. I know I went over. I appreciate your thought leadership, everyone, and your passion. It's been a challenging project, and all we can do is keep trying to think of more ways to support families, and that's what you're doing. So very grateful for the work you do already and the compassion you bring to your work. Thanks very much.
And we thank you for coming and talking and presenting about important information for today's day. And thank you for taking Sorry for delay. We're waiting for our next presenter. Rebecca, are you ready?
Hi there. Yes,
Thank you for taking the time to present.
absolutely. I'm assuming you are ready for me. And
Yes,
I got stuck in Teams world there for a second.
that's okay.
Apologies.
That's okay.
I'm not sure how that happened, but
Let me see if give you access to. You have any slides?
I do have slides. They're also available on our website. So I'm going to drop that link in the chat, but then I will go through our slide deck. And good morning, everyone. Thank you so much for having me in this space. My apologies for my hard entrance there. My name is Becky Carroll, and I serve here at the Healthcare Authority as the Deputy Division Director for Medicaid Programs. So essentially what that means is that I have the privilege of serving our team that oversees the state's Medicaid managed care contracts. So everything from the actual contract document to quality, to oversight, to issues as they come up. We also, in our division, are responsible for our behavioral health administrative services organizations. So the contracts for the state's crisis system. And then we also oversee non-emergency medical transportation, which helps our Medicaid population who need assistance accessing, actually getting transportation to their appointments, as well as interpreter services for both spoken and sign language interpreters. And then let's see, maternal support services and school-based health services. So I have the privilege of working with very talented people in a lot of different areas of Medicaid in our safety net. So happy to talk a little bit about HR1 in that I appreciate the opportunity to share it all with you. We do have a great slide deck here. And let me just see if Zoom will not let me share it. Perfect. So I will, hopefully you can see my screen. I'm going to walk through these slides with all of you. I'm going to put, it is publicly available, this entire deck on our website. So I will put that in the chat and I'll walk through these slides and happy to try to answer any questions that you may have. So I think you're all aware of House Resolution 1, also referred to as OBBA or the Big Beautiful Bill, and that passed in early July, right before July 4th, signed into law by the president on the 4th. Lots of different changes in this bill to many of the services and programs that I think all of you and certainly Healthcare Authority interact with. So Medicaid, food assistance, the individual market on the health benefit exchange, all of these pieces impacted greatly by HR 1. We are estimating that hundreds of thousands of Medicaid eligible Washingtonians will be impacted by the passage of this bill. We are still working in conjunction with DSHS and other state partners, Health Benefit Exchange, to really understand the full scope of access and issues for not just Apple Health, but Washingtonians in general. And we do expect that there will be many impacts to the way that we administer our programs, and that it will be quite costly to the state of Washington. So as we move through here, this slide has lots of information on it. I'm going to just sort of do top level pieces for you. There are restrictions, right, for payments of healthcare services. Funding for non-citizens is prohibited, and so you're seeing some of this already coming into effect as early as July 4th of this year. And then sort of spreading out through now and into October of 2029. We'll dive into these in some of the slides that come up here, but changes around eligibility, work requirements, or community engagement requirements, I think they're also called. Hear that a lot. There's changes to rural health funding. There's increasing how often we check eligibility for our adult population and the Medicaid population in general. So how often are we redetermining folks' eligibility? Right now it's a year. For many, it'll go to 6 months, every 6 months. It changes the way that we can handle retroactive coverage for folks. State-directed payments are impacted. And I think for this group, probably you'll see the largest impact to the way that our hospital network's funded through SDPs or state-directed payments. We'll see cost sharing in our state and changes to the way that we verify folks' addresses. And changes to some of the more operational pieces of the Medicaid program that you probably don't see every day. When there are erroneous payments, incorrect payments, it changes a lot of the good faith waivers that we've had in place as a state and as a nation as we move forward. This timeline is, I think, our best attempt at kind of showing how these impacts will flow and happen and occur as we move through the next few months. So, restriction on payment for protected health services happened July 2025. This was specifically impactful for Planned Parenthood in our state. And so more information on that here in a minute. But we'll be moving through the next couple of months. You'll see some changes to the way that we can look at addresses for folks, make sure that we have the right address for those on our Medicaid, the way that we look at compliance. The Rural Health Transformation Project is a big one you may have heard about. Our agency is applying for this new rural healthcare grant. We do expect to be able to turn in our application on time. Those will be adjudicated in December. We'll see and hope for a good outcome for the state of Washington. The next big piece will be impactful in October of 2026. And in December of 2026, when you see changes to those who are lawfully present, but non-citizens lose coverage to Medicaid for Medicaid, and then you'll start to see the work requirements come into place, as you can see here. And it kind of goes through, you'll see state directed payments, so that in the outer years of 28, you'll start to see some changes to the way hospitals are funded by Medicaid, and then additional pieces as we move through. So work requirements, I think, have been in the news. I get lots of questions about this component of HR 1. We are thinking that we're going to have about 620,000 Washingtonians impacted by work requirements and changes to the way that we determine folks' eligibility. We'll also have the lawfully present non-citizens losing access to programs, and a reduction in our federal funding overall, right, between 2025 and 2034. So we do expect a decrease in the amount of funding for Medicaid. I think that's pretty well known, but always like to kind of highlight that for folks as we think about this program. So prohibiting payments for protected health services. This was especially impactful for Planned Parenthood. It prohibits federally funded Medicaid payments to nonprofit organizations who engage in family planning only services or family planning services, in reproductive services, and also provide abortion services. So I think, we have been very clear as a state. This will reduce the amount of federal funding that flows into our state by 11 million. But we remain committed as Washingtonians, and I think the governor's office has been very clear about this. We're committed to continuing to fund these critical services. But again, this was the first sort of wave of impacts that we saw with HR 1. We also have some Medicaid eligibility changes, right, that come into effect in October. We're thinking this could impact over 30,000 individuals enrolled in Apple Health. Some of these individuals, right, may be eligible for other programs that we have here in the state. We have had a long history of investing in healthcare for all Washingtonians, regardless of citizenship status. You'll see that in programs like the Apple Health Expansion Program, which is our managed care Medicaid lookalike program for non-citizens. We have our 1332 waiver on the exchange, first in the nation, that allows individuals who lack the immigration status to participate on the federally subsidized exchange to do so with state subsidies. So it's cost neutral for the federal government, but we did need and require a waiver from Center for Medicaid and Medicare Services. We've also long had our emergency medical program. It's often referred to as AEM. Our emergency medical program covers folks for emergency room visits in the traditional sense, a broken arm, a car accident. We also here in the state of Washington cover cancer treatment, post-transplant prescriptions and drugs, and dialysis treatment. So we have sort of 4 components to that emergency medical program that remain intact. And then we also have a pregnancy and after pregnancy coverage programs for individuals who aren't eligible for Medicaid due to their immigration status. By December 31st of 26, we'll be required to institute work requirements as a new condition for Medicaid eligible adults 19 to 65 who receive full coverage benefits. It'll make coverage contingent on working, training, or doing community engagement of 80 hours or more a month. And again, applies to folks who are 19 to 65 who do not meet an exemption. And so what we'll see here is, Medicaid enrollees working. Most of our Apple Health clients do work currently, or they're dependents of working adults. So this is impactful in that they will have to declare or prove what they are doing in our communities, whether that's paid work or volunteer work. We do expect that adults will lose coverage as a result of this requirement. More than 620,000 adults would be at risk or lose or delay coverage because, again, we'll have to have people report this in. This is additional documentation, additional barriers to coverage for folks. So we do expect to see folks fall off the program. We could apply for a waiver, and I think our intention is to apply for a waiver. This is an interesting area, and I think really displays the change in our relationship with CMS. We will apply for the waiver. We're waiting for some additional guidance. We have also been told by CMS not to expect to get a waiver. And so really doesn't sound like a possibility for us as a state or for states in general. I wouldn't say they were targeting Washington. I'm just noting that they said, oh yeah, we'll have the waiver available. You may or may not get it. I wouldn't count on it. It's sort of what was conveyed to us. So there's some exemptions, right? And there's a lot of informational points on this slide. Everything from pregnancy or receiving postpartum coverage, right? They're under the age of 19. So I think that's an important piece and comes up a lot for folks. If you're under the age of 19, you wouldn't have a work requirement. The foster youth and former foster youth under the age of 26, it excludes tribal members, so those would have they would have an exemption. Medically frail, I think we're still waiting for definition and further guidance from CMS on what medical frailty is and how they'll be interpreting that. We have disabled veterans, right? They're entitled to Medicare A and B. I think the other thing that we are really hoping to get better policy guidance around is parents or caregivers of a dependent child or an individual with disability. And so just highlighting that for this group, we're not sure if that is a self-attestation or how we would certify that as a state and what CMS will define as eligible for that exception. So still waiting for some information here and certainly happy to provide updates as we get them, but there are still a few things around work requirements that we need further guidance from CMS on, and we are nervous about that as we move forward to next December. So that those requirements will obviously have a large administrative burden, not just on clients, but on the state of Washington and how we implement those, how we keep track of that, how we ensure that folks are not losing coverage under these new requirements. At the same time, we'll be increasing the redeterminations for eligibility. So right now, folks have to be redetermined every year. 80 to 85% of our population automatically renews. So we are set up well there in the state. But we do have a significant portion of folks, right, who need active management. And so they do need someone's assistance as they apply for redetermination or meet the needs for redetermination. Often we need information that we cannot access through a publicly available database to ensure that the person retains eligibility. So we'll send a letter and ask them to respond. So this slide really speaks to that. We think the impacts would be around 620,000 adults who are enrolled in Apple Health, and that could lead to thousands of individuals losing coverage. And so just sort of noting that for scope, right? We noted earlier, we were talking about hospital payments and the way that we fund hospital networks here in the state, and that is directly related to this state directed payment slide, although it's impactful to providers across our network. But there are some new requirements around state directed payments and provider taxes that prohibit new provider taxes and ramps down existing provider taxes from 6% to 3.5%. So that reduces some of the revenue used to support the program. It prohibits new STPs from exceeding Medicare payments. So in our state, we have made some significant investments in our providers and our hospital networks. So you'll see those having to be repealed and reduced as a result of HR 1. And so this all will lower the amount of federal funding that we as a state can draw down to continue to support both our local health system and our Medicaid program in general. Brittany, go ahead. Oh, I'm sorry, you had a
Sorry,
question.
just
Yeah.
Oh, that's okay. I didn't want to move on from this SDP question
Yeah, sure.
around the funding. So does that mean that the federal guidance is that Washington as a state cannot pay providers more than the Medicare rate? Is that what that's meaning? Or can you explain?
Yeah, so essentially, I think, Brittany, what it does is it says that as a state, we cannot pay above that Medicare payment level and receive federal match for that payment.
I see. Okay. Okay. Thank you.
Yeah. And then you had a question around non-citizen coverage barriers going to impact children and youth. And that's a really great question, Brittany. I'll take that one back. I think my understanding right now is it's really going to impact adults for the most part. But that's a great question. I'll find out.
Okay. Thank you.
Yeah, absolutely. So more here sort of on the impact of state-directed payments or STPs and provider taxes. So we use existing STPs to support hospital services, including hospital safety net assessments and payments to the UW. These will be reduced. We're expecting about 1.5 billion annually once all of the reductions are in place. I think you saw on the timeline there, that's 2028. So it is definitely in an outer year, but still something that should be on our radar here as we're thinking. Speaking of 28, in October of 2028, the state will be required to put into place cost sharing requirements. These will require adults to pay cost sharing of up to $35 for many services under the Medicaid program. It will force out-of-pocket spending for individuals who may be earning as little as $16,000 a year. And so I think, we are all aware of the population that we serve in the Medicaid program and with many of the programs that you're all participating in. So this will cause people to forego services. These will require very difficult choices on behalf of Washingtonians who receive these vital services. So Brittany, go ahead.
I'm sorry. I'm wondering if there's going to be any exceptions to this cost sharing requirement if they fall under any of the work requirement exemptions. Like, is there
if it trickles over to this?
Yeah.
Yeah. So if they're medically frail, whatever that means under the CMS guidance here, right? Does that also mean that they wouldn't have to do the cost sharing piece?
Yeah.
I think that's a great question. And again, I'm not sure that I know the answer to that for sure. I think we're really waiting for CMS guidance on that. But Brittany, I can take that back and ask my colleagues and get back to you. It's a great question.
Okay, my particular area of interest for full transparency is the foster kids who in the alumni youth, because that's the population I serve. So I'm just curious about that. And it's okay, we don't have an answer. It's just an area of interest.
Yeah, no, I think that's a really good question. So I'll ask if are there exceptions for cost sharing, and just make a note to myself real quick. Okay. So this removes another provision removes good faith waivers related to erroneous payments. So the ability to waive federal penalties for good faith effort, right? For a state who notices an issue and fixes any erroneous excess Medicaid payments. This has been something that's been in place for a long time in Medicaid programs across the nation. This will change October 1st of 2029. So we have a few years to prepare for this. But under what they call the Payment Error Rate Measurement Program, or PERM, CMS audits Medicaid and CHIP programs to identify various types of improper payments. And so under the new regulation, if it's more than 3% of a state's total payment in a year that are deemed improper, CMS disallows federal funds, so that federal match for the excess payments above that threshold of 3%. CMS used to retain the right to authorize and waive that disallowance if the state was unable to achieve a 3% target, despite good faith efforts. And there's a lot of barriers to getting to 3% that states have been working on for many years, since I've been involved with the Medicaid program. And nationwide, that proves out. Perm rates were 3.31% in 2024. So they're low, but they are not below 3%. And so just to kind of give you some scope and scale there, the CBO, the Congressional Budget Office, estimates that that provision will reduce federal investment in the Medicaid program by over $7 billion over a 10-year period. So it is impactful, very impactful to the way that we do our work. Rural healthcare funding. So this is an area that you may have heard a little bit about. Between July and September, we saw CMS go ahead and release an application and a letter in direction to states about how to fill out that application. Some colleagues of ours here at the Healthcare Authority have been leading that effort for the state, and I think have been working cross agency-wide to get this filled out. It allocates $10 billion annually to states from 2026 to 2030. It can be used, of course, to support transformation projects in our rural healthcare systems, promote care, support providers, invest in technology, ensure access, right, to our rural communities. We have to apply by December 31st. Or I'm sorry, we have to apply, I think, by the end of the month, and then applications will be approved or denied by December 31st of 2025. We must also include a rural health transformation plan as part of that work. And we have worked, I think, as an agency for a while now on this topic, but certainly we have a lot more work to do to get this grant out the door in such a short period of time, that I think we are right on target there. Other Medicaid provisions that change eligibility requirements. There are changes to home equity limits for long-term care eligibility. It shortens the period that we could do retroactive coverage. So if an individual doesn't respond to a redetermination letter and loses eligibility coverage for a certain length of time, but then is able to prove that they had eligibility for that whole time period, right now, we can retroactively cover someone for 3 months, but this will change that time to 1 month for most adults and 2 months for other Medicaid eligible categories. That becomes effective January 1st of 27. And then the way that we verify addresses will change, and that will be effective October 1st of 2029. So most of you can see lots of things that are going to change our processes and the way that we interact with our agencies and with our clients in general. So there will be a lot of new sort of administrative pieces and components to Medicaid that will have to change and shift. So lots of work here. And unfortunately, many more barriers for our clients as we move forward. So I'm going to move a little bit here and talk about some of the changes in the marketplace. So federal policy changes to the Affordable Care Act. And so we are estimating here with our friends over at Health Benefit Exchange, enrollment reduction of somewhere between 35 and 50%, increases in premiums of up to 15%. And then causing some ripple effects right across our system and increasing uncompensated care up to $100 million. So lots of things here on this slide, a lot to ingest there. But I think, you know, a lot of things that are pending litigation at the moment around some of the new marketplace rules. So the shortening of the open enrollment period, the narrowing of eligibility and the affordability and benefit changes are all things that are pending legislation at the moment. We do estimate, though, if the rule goes into effect, enrollment reductions of about 23% and premium increases of 4.5% with some of these CMS rule changes. So really, some of the things that you'll see that are happening right now. So we do expect on January 1st that about 10,000 individuals will lose their advanced premium tax credits and subsidies on the exchange. These will be folks that are lawfully present non-citizens that are receiving those subsidies right now. And so unfortunately, they will lose coverage as we approach that January 1st date. In 2027, they're estimating around 15,000 individuals who are lawfully present, non-citizens, will also lose coverage due to changes and impacts of HR 1 on the exchange. And so they, again, will be losing their premium tax credits for low income and, premium tax credits and subsidies. And I think this does not include, and I'm just checking my notes really quick, I think it doesn't include, so the 15,027, these are not folks who are COFA or Cuban and Haitian qualified eligible individuals. So just noting that they are exempt from that 2027 change. So, and you'll see further changes in 2028. Lance, are you familiar with the federal Medicaid matching to our state for providers of community services? Yes, I am familiar, Lance. I'm not sure. Did you have a specific question there? Are you asking for impact state from HR 1 through the waivers? Through the
Yes,
transformation waiver, Lance, or?
through the Medicaid waivers, you know, these impacts to individuals are horrible, but there's also would be potential impacts to funding that providers of community services through our Medicaid waivers would see. Do you have any information on that?
So Lance, I think there are some downstream impacts. I don't have direct information or total costs or estimates on that at the moment, but that's a great question. Also wondering about the Medicaid carve out for NDCs. And Carrie, if you want to give me more information there, I'll see what I can do about answering that.
Can you hear me, Becky?
I can, yeah.
Okay, hi. Carrie Tanta from Mary Bridge. So presently and for as long as I can remember, the NDCs have had a carve out for Medicaid. So, you know, not needing referrals, kids having basically unlimited visits, wondering if we're hearing anything about that.
So no, Carrie, at this point, I haven't heard about impacts directly related to HR 1. Again, hoping, right? Oh, thanks, Kate. I was just going to say, here are developmental centers for those who aren't familiar with that acronym. So Carrie, yeah, I haven't heard of any changes to that. And Lance, I could take back the community services and impacts from the waiver and see what more information we have. Again, we're still sort of head down consuming all of the implications of HR 1. And so there are some questions that I think we're still opining on.
Great. Jamie may have some information as well in the next segment.
Oh, great. That would be wonderful if she did.
I'm typing a response right now, Lance.
Oh, Jamie, great. I thought I saw you come on camera. I was going to say, good to see you, by the way.
Same.
All right. So these were sort of an overview of the marketplace impacts. And then enhanced tax credits, the impacts there, you can see, you know, 260,000 people receive these enhanced premium tax credits. And you can see these all expire in 2025. You're probably hearing lots about this in the news. And so there's some familiarity around these. I think interesting to see how this will turn out as we move forward. But we are expecting somewhere in the range of 80,000 folks losing enrollment, increases of 65%, loss of $285 million in federal funds for those tax credits. So pretty impactful here as we think about that and watch what's happening at the federal level. So that is sort of the end here. I do have loads of slides, and I think I put the link in the chat there that give you some background information about Apple Health, the number of folks that we're serving right now, what that looks like across the county and the demographics. So lots of just sort of basic informational slides around Medicaid, and happy to answer any questions that you might have that I haven't answered. I'll try my best there.
Another question from Gabriella in the chat
Oh, perfect.
about who at the state level can we contact regarding the rural health grants. Recently informed that the public hospital district in Lower Yakima Valley was exploring options. Yakima Valley has been impacted by closing of hospitals, such as loss of resources, and sparked by closing of the maternity unit at Toppenish.
Yeah, Gabriella, great question. I can certainly put you in contact with Kaylee Dufresne, who is leading that effort here at the state. So let's see here. I'm going to pop into the chat where you can find these slides, and then also put in the chat my email address. So if you want to send me a quick email, I'll make sure to get some virtual introductions there, Gabriella, for you. And then I owe Carrie, Lance and a few other folks too, Brittany, some answers to questions.
Thank you.
Yeah, absolutely.
Becky, I have a question about, you mentioned the waivers and that there'd been some communication that, future waivers might not be approved. I'm curious about things that we already have in place around like continuous eligibility for young children, things like that. Can you speak to the status of those programs?
Yeah, so I think continuous eligibility 06 will not be renewed. That is part of our Medicaid transformation waiver. And so we will see those end at the end of 28 or June of 28. I'm sorry, the waiver starts July 1st. So the services would end June 30th, Monica, to be specific there. I don't know what our new waiver will look like. Our new transformation waiver, I know we will look to have Medicaid transformation waiver 3.0. For those of you who are less aware, our current transformation waiver includes foundational community support services, which is a housing program. We are in the middle of implementing reentry services, which provides healthcare and care coordination for individuals who are exiting carceral facilities across our state, including juvenile facilities, and then a number of health-related social needs that we have some waiver dollars to do some investments in things like medical respite and medical nutrition or nutrition supports. So we are in the middle of implementing this current waiver for the waiver period that we are in. I am not sure if we will get approval for all of those components. It's just too early to tell at this point, Monica. But those are the things that we know about the transformation waiver right now. We know continuous eligibility will probably not happen. And I'm guessing that we're not going to get a lot for social determinants of health, or what we're calling health-related social needs. But more to come on that.
Kate has a question in the chat about the impacts of the waiver on the accountable communities of health.
Yeah, no, I appreciate that, Kate. And I think the ACH piece is a separate conversation. And certainly I can get some information for you on that and get you connected to the right group of folks.
Thank you so much, Becky.
Absolutely. Thank you for the opportunity. And
Yes, thank you for your time.
Yeah.
Okay, we're gonna move with Jamie from DDCS. Jamie, are you ready?
I am. Good morning. I hope I have better news than Becky, but not really. So, I am Jamie Bond. I am, as of the 1st, my title changed. What am I now? I am the Deputy Director of Headquarters Operations at the Developmental Disabilities Community Services, which is now, it's a division that is now part of the Home and Community Living Administration as part of DSHS. And that is what I'm here to talk to you about today. I actually did a presentation for a group of y'all a couple weeks ago around the impacts of what Becky was just talking about, the HR1, specifically on the population served by DDCS. And then I was asked to come here and talk a little bit about the changes that we are experiencing at DDCS, different from the changes that are coming out of the HR1. So Lance, really quick, just to address your questions. I think other people probably have a similar question. The HR1 bill that Becky was just talking about really is specifically mainly focused on eligibility for Medicaid or Apple Health directly. It doesn't actually speak to once you're eligible, what you can and can't get, essentially. So folks who are receiving services from DDCS under one of our waivers, there's no talk in the HR1 about changes to rates or services. We're not reducing services. We're not eliminating services. All that to say, you heard what Becky said, though, about the impacts to the budget for the state. And so the legislature is probably going to make some tough decisions about whether they want to borrow from Peter to pay Paul, right? Do they want to reduce some services or funding for DDCS specifically so that they could help fill some of those gaps from the HR1 that's going to impact a large swath of folks from the Medicaid agency. So more to come on that. And I think, do you have more questions about that, Lance?
Jamie, I think it would also be helpful to talk about the piece that you shared at our Family Advisory Council meeting about those 6-month, that change is not applying to the aged and disabled population. That is going to continue to be at 1 year. Is that correct?
Yeah, so for most of the population that is supported by DDCS and our partners over at the Home and Community Services Home and Community Services Division, they're eligible for Medicaid through classic Medicaid. So they're eligible for Apple Health through essentially receiving SSI benefits or being in a category that looks like they're like SSI recipients, right? So those are not going to be impacted by the HR1 eligibility changes in terms of how frequently folks have to have their eligibility reviewed. It's really those folks that are, and Becky, if I'm getting this wrong, jump in. If there's folks who are who have come through the Apple Health door through the Medicaid exchange, through the Affordable Care Act, or what we call the MAGI population, that those folks are going to have the more frequent eligibility reviews, which is not the vast majority of the folks that we support at DDCS. So they won't be super impacted. They will be impacted by all the SNAP benefits and all those other things, the food benefits, those kinds of things for sure. So they're not getting away scot-free. It just won't be, the eligibility for Medicaid won't affect them quite as much as the rest of the population.
You're spot on there, Jamie. You got it.
Woo! Have you tried to read the HR1 bill? It's a lot. Okay, so I think I can share a screen. Can I share a screen? We are Teams people. Oh, I see a share button. Oh, I can't share. Never mind. So if it's someone, I think I sent over a PowerPoint to somebody that you might want to share for me. If you could,
We can
please.
share now. I just
okay.
Yes, I just had to make it co-host.
Okay, if I could find where I'm looking. Okay. Share. Am I sharing a PowerPoint? That's what I'm trying to do, if I'm not.
You are, but it's not sharing like the presenter view. It's just sharing the slide deck.
Oh, well, how do I get rid of this little guy here? Oh, there we go. From beginning. Oh, how's that?
No, it did. Oh, there we go.
Oh, okay, perfect. All right. So I'm going to share really quickly with all of you some changes that are happening or have happened at Developmental Disabilities Community Services, which is one, we have a name change. So on May 1st, DSHS launched Reimagining DSHS, which was an initiative to attempt to get to the governor's directive of state agencies getting out of their own way, right? Like let's get out of our own way and let's try to reduce the bureaucracy and figure out a way to streamline access for services for individuals. So what DSHS has done in reaction to that, or response to that, is attempt to reimagine ourselves. And that meant creating a couple of new administrations. So DDA, so former Developmental Disabilities Administration, split into two and combined with two other administrations. So the folks that we support in 24-hour, 7-day-a-week settings, so our state operated living alternative settings and our institutional settings at our residential habilitation centers, moved over into a new administration, moved over with Behavioral Health Administration to become behavioral health, or to become a bigger administration under BHHA. The rest of us, the folks that I have historically supported in my world, are the in-home folks, the folks living in home with their families or in their own homes, receiving our services. We became a division and changed our name from Developmental Disabilities Administration to Developmental Disabilities Community Services Division under the new Home and Community Living Administration. So we have sort of merged with our friends that we have worked with very closely forever. Home and Community Services, the Adult Protective Services, residential care services, that team of folks historically under the ALTSA, Aging and Long-Term Support Administration. So I put in here an email box if you have questions, comments, or concerns about that, but I also put a link to the DSHS website that I'm going to show real quick so you all can go and get additional information if you want to. One of the things that I think is super relevant here is we have links to the DSHS impacts for HR1. So just to continue the conversation from Becky, we have done a DSHS, well, we worked with the Healthcare Authority on that presentation that Becky just showed, but we've also done our own a little bit of deep dive. And again, for our population, it's really about impactful on the SNAP benefits. So we have some information there. And then also we have some information on Reimagine here, where you can go and look at the organizational changes that have happened under Reimagine. So feel free to go there, look around. Oh, I've lost my, I don't know what I'm doing, but I've lost myself. I'm telling you, being a Teams person, you think Zoom wouldn't be that different, but it is. Okay, there we go. And then I want to talk really quickly about our biennial budget and how we're implementing that. So DDA is still the category that the legislature funds. So even though DDA doesn't exist since May and we become part of two different administrations, our budget is still all DDA. So we got $5.5 billion in our legislative budget for the biennium this year, and that includes our 24/7 operations that have now become part of BHHA. Highlights for us, so positive stuff for us, are we got some rate increases for our home care agencies that provide personal care and respite, the consumer directed employer that is the employer of 70,000 or so individual providers that provide personal care and respite to our population. Our community residential services group got a raise. Those are the folks that provide supported living. We also got rate increases for a group of providers who haven't received rate increases in a very long time. So those folks provide community engagement, life skills, peer mentoring, and some of our respite. So yay for them. And that budget has some real impacts on our staffing at DDCS. So one of the things that it does is it has line items for some specific types of positions that we had to eliminate effective July 1. those folks, if you're not familiar with how things work at the state level, seniority rules. So people, when positions are eliminated, there's some bumping around of folks. So we haven't quite landed yet on everybody moving into where they're going to be and where they're going to land. But just for a general overview, these are the kinds of and types of and number of positions that we lost out in our field that is going to be impactful to individuals, particularly if you see that 22 case resource managers for our no paid services. We had historically had case managers assigned to our 15,000 or so individuals who are on our no paid services caseload. So they're eligible clients of DDCS, but they're not receiving a paid service. We had those individuals in the 2012 reduction. We lost those individuals. They were FTEs that were removed from our roles. And those individuals began or didn't have an assigned case manager, but they did have access to us still, right? They had an 800 number they could call, they could get services when they needed them, but they didn't have a person to call. They had to leave a message and we'd call them back. Our advocates and ourselves fought pretty hard the last couple of years to get those case managers back. So in the last couple of years, those folks did have case managers assigned to them. Those were removed again. So we did lose 22 positions out in the regions for those positions. So those folks are going back to having an opportunity, of course, to still get to us, but they don't have an assigned worker. So they have an 800 number again that they can call and leave a message or go to our website, get an email, all those things, but they won't have a person to reach out to them every single year and ask them how they're doing and what services they need. That's a bummer. Other big impacts you'll see is that 20 public benefit specialists. Yikes. Those are the folks that determine whether someone is Medicaid eligible. So financial eligibility for benefits like Medicaid, food assistance, health care for workers with disabilities, hospice, all cash assistance. Those individuals, we had to reduce by 20 FTEs. The impacts to the folks that we support we had to reduce our call center hours. So our call center is not only open till 4 now instead of until at least 5. And so that's impactful. We're monitoring that to see, how long wait times are increasing. Hasn't been super impactful yet, but there's no doubt that will be a pain point for individuals when they're trying to get their Medicaid either established or redetermined. We've asked in the next biennium to have them back, but we've asked for that multiple times and we have not received that. So we shall see where we land with that. In terms of headquarters impacts for staff, if you're used to working with headquarters, we also lost 59 positions at headquarters. That is a lot. It's about a third of our staff at headquarters. So all that to say, we've had some changes. If you're familiar with working with someone, try reaching out to them. They may be in another spot and they may be able to point you to who might have replaced them. But everybody has a boss, right? So if you are stuck somewhere, you can't get a hold of somebody, I put a link in here to our office locator and you can go and get yourself a link to a phone number to call either one of your local offices or headquarters. You will get a body when you do that. So someone will answer the phone and point you in the right direction if you do that. So that is one way to get your needs met still. And then what else do I have? Oh, and then this is the last thing I'll share really quick. So in addition to losing a bunch of full-time FTEs, we also got a handful of positions that are project positions because the legislature has acknowledged that there is a need for some positions to continue. One of them is financial eligibility. We lost about 20 positions, but we got 5 or 6 in for project stuff to help us implement some of those really complicated rule changes that have come down from the federal government in the last couple of years. One of them being the HR1 project. We also have the Access Rules project. The Access Rules were a complicated set of rules that CMS put out a year and a half ago, the spring of 24, for states to follow, and they change eligibility rules for financial eligibility pretty significantly. So, and other rules, they're very, very significantly impactful to how the state does Medicaid, implements Medicaid programs. So we have some folks on board for that. And then we have, as Becky was mentioning really quick at the end of her conversation, was about health-related social needs. So we're partnering with the Healthcare Authority, and we got a couple of people to help us implement some new under the 2.0 Medicaid transformation waiver, a health-related social needs project. And I'm sure we will come back and talk to you about all of that when we sort out who's doing what to get those services out for folks. So I'm going to stop rambling. I'm going to stop sharing, and I'll answer some questions if you have any. Perfect. Am I off the hook? This is great. Like, look in the chat to see if there's anything for me.
Hi, Jamie. I have a question. One of on the slide where you were talking about the different reductions, there was a line item about electronic records project. Can you talk more about what that project was?
Yeah, so we are still in the 1900s at DSHS in many ways, because we spend our money on client services and not on infrastructure. So we at DDCS still have paper files. And the electronic health, we got some funding a couple years ago from the legislature to hire some folks to help us move those paper documents into an electronic form, scanning essentially into a database and into our system. Those were line item reductions in the budget. So we do not have those staff anymore to do that, to work specifically on that project. All right, 2 minutes. It's a free for all. You can ask whatever question you want.
All right, Jamie, I'll pipe in.
I knew it.
On one of your slides, I think you said 5.5 billion that you received. It wasn't that 5.5 million.
No, in the overall DDA budget is big for the biennium. So we got a big old biennial budget last year.
Right, but the increases for the providers wasn't 5.5 billion, right?
Oh, no, that was the total
Right.
budget. Sorry. Yes.
Yeah,
No,
no
the increase
worries.
for the providers was like, what, 2%, I think? Something like that. Not a significant increase. Some, but certainly not a giant amount. I mean, none of it was a giant amount in terms of the rate increases. We had a number of providers who haven't received a rate increase at all for years and years and years, and they got some, but they're not our they don't serve a ton of people, and they're not the super expensive services. The ones that were the community residential services, and 2% sounds like a lot, or 2% on paper when you multiply it across, thousands of providers is a lot, but in the grand scheme of things, it's not even enough to keep up with inflation, as we all know. So. All right, folks. I think my time here is done, but I'm happy to come back and talk about whatever topic you guys bring my way.
Thank you so much. We appreciate your time, taking the time to present and talk about all the changes. Thank you. Okay, I'm going to share my slide. Let me know if my slides are in the right spot. Are you guys seeing the right slides?
We're seeing the presenter view. That's okay.
Okay. There we go. So just some closing step. We're gonna have our networking session next, but if you have to hop off, please fill out. So our meeting minutes and recording will be available in the coming weeks. I will be sending them out. Our newsletter will be coming out during that time too. Please fill out the evaluation. And please fill out any, we're going to put the form for the program updates if you have any. And if you have any additional questions or information that you need, please email the Chiskin inbox at chiskin@doh.wa.gov. And then we're going to come back for the networking session around 12:10. So we have about 9 minutes. So if you would like to join us, please stay on and we'll be back in a few. Thank you.